Here we have Christine Ulrich. She's 27. She had an open reduction internal fixation of the right femur, and this is her second postoperative day.
Hello, Mrs. Ulrich. How are you feeling today?
Fine. I've got some pain, but I'm ready to get out of here.
Well, how was it that you broke your leg?
Well, see, the goat likes to climb up on my car and sit and tear up my windshield, then hoof it up and horn it. So I climbed up on top of my car to push him off, and he headbutted me, and I rolled off and broke it.
Sorry, I'm sure that's not funny to you yet, but... Okay, could you please pull your toes back towards your body? Do you have any pain?
No? Why does everyone keep asking me that?
Well, we're checking to see if you may have developed any blood clots. If you experience any pain in your calf whenever you pull your toes back up towards your body, then that could be a sign that you've developed a blood clot in your lower legs. Several things predispose you to blood clots right now. First of all, you broke a long bone, you had extensive bruising with that injury, and you had surgery to repair that. Also, the fact that you're immobilized by your injuries predisposes you to blood clots, and you take birth control and you have a lot of varicose veins.
So, am I going to get a blood clot then?
Well, not necessarily. There are several things you can do to prevent getting a blood clot. You should raise your legs at least 6 inches above your heart from time to time. And while you're in the hospital, you should wear your sequential compression hose below on your lower legs as ordered. Let's check.
Okay.
Oh, they're off. Let's refasten them.
Why don't people like to wear them?
Okay, you can also help prevent blood clots by performing the physical therapy exercises as ordered, changing your position in bed or your chair every hour or two, eat less salt, do not cross your legs, and take all of your prescribed medications.
Well, why can't I cross my legs?
Well, when you cross your legs, you're basically preventing good blood return to your heart, and anytime that blood stays in one spot, it's likely to clot. Besides, I think in this big long cast you've got on, it'd be pretty uncomfortable crossing your legs anyway.
And the medications that we give you to prevent blood clots include that Lovenox shot that we gave you yesterday.
It's a low molecular weight blood thinner.
And you'll continue taking aspirin daily until your doctor tells you to stop. If you were older or you had more risk factors, then you might have had to been prescribed Coumadin or warfarin too. But you're pretty young and healthy, so it isn't necessary at this time.
Can I still take my birth control?
Well, if you plan to be sexually active, you should probably continue taking it. If you're considering stopping the birth control pill, you should definitely ask your doctor first.
Are you keeping a list of questions to ask your doctor when he comes in? It's generally a good idea to go ahead and keep a list of questions when you think of them. That way, you know, whenever he comes in, you don't forget to ask, should I stop taking my birth control? So that's one question you may want to add to the list. Now, after you go home, you need to continue to make sure you're doing the same sort of things that we've told you to do while you're here. You're going to change your position often. You're going to get up and move around every hour or two. Keep your legs propped up intermittently. And you need to try to prevent any further injury.
Yeah, and maybe somebody else should take care of that goat for a while.
Also, didn't you tell me yesterday that you were planning a trip soon?
Yeah, I'm gonna go to the Bahamas with my sugar daddy. 'Cause after that goat incident, I kind of shot the goat. And my husband plans on divorcing me.
Okay, well, you're still going to have your cast on when you travel. So you need to make sure that you use your crutches correctly and take precautions to prevent your blood clotting during the flight. Since you're going to be on an airplane for a long time to get to the Bahamas, then you'll be at higher risk for blood clots. So what you need to do is make sure that you wiggle your toes a lot. If it's possible with your crutches, just get up and walk the length of the aisle or back to the bathroom every few hours. You can kind of rotate your feet at the ankles and perhaps find a way to lift your legs. And also, don't cross them.
So, how will I know if I've got a blood clot?
Well, there are some symptoms that you can look for, like swelling in your leg, redness, tenderness accompanied by heat, or pain in your calves. You should also report any signs of shortness of breath
That's all we do.
Shortness of breath. Okay, now. Shortness of breath, racing heart, fainting, low-grade fever or a cough with or without blood, as these can be signs of pulmonary embolism, which means the blood clot has went to your lungs.
So, do you have any questions?
So, what do I do if I have signs of a blood clot? Am I gonna die?
Well, blood clots can be very serious, and they can be life-threatening. So if you experience any of the signs of a blood clot, you should definitely call your doctor. Can you recall at least 4 of those signs we just talked about?
Sure.